My talk is rather a continuation of Ferencz's talk about the PVR, and the purpose is to introduce you to a new term, which I hope will be in the future quite commonly used. And this is, we have tested a new agent which is called Decorin. So I'll go through it quickly into the introduction. PVR, we know, is a real menace, particularly in trauma cases. And we have the cytokines, and the transforming growth factor beta is the master regulator, and it has detrimental effects through the transforming of the mesenchymal fibroblasts, ending up in contraction. But we have Decorin. What is Decorin? Decorin is a normal proteoglycan, and it is called Decorin because it decorates the collagen fibers on both sides. How does it work? Well, anyway, it circulates in the blood, and it has been identified in many tissues. Its anti-fibrotic effect is through several mechanisms, mainly transforming growth factor inhibition and regulation of the extracellular matrix, and other mechanisms as well. And its anti-fibrotic effect has been demonstrated in other tissues like the kidneys, and it has been used experimentally in glaucoma surgery. We have started an experimental study on rabbits, and it has proved really exceptionally effective. And this work I'm going to present is a continuation of this experimental study. So it's the first pilot study to determine the safety and the efficacy of human recombinant Decorin in the prevention of PVR in perforating eye injuries. So these our patient population. Remember, this is a pilot study with 12 patients with perforating globe injuries, zone 3, which is known to be the worst ever, with a lot of PVR and retinal detachment. Our age group from 18 to 40, and primary repair was done within the first 24 hours from the injury. And then a single intravitreal injection. We started with the 200 micrograms in the first 4 patients. When we found that safe, we started the 400 in the rest of the 8 patients within 48 hours of injury. So we did the following: a baseline ERG, followed up ERG after removal of silicone oil. And we did some labs. We tested the Decorin levels in the serum and in the vitreous of these patients because we had a kit, a PCR kit, which can run for 50 samples. Pars-plana vitrectomy with silicone oil injection was done in all patients at the 10th day, Ferenc, not immediately. And there was no chorioretinectomy to standardize and to see the effects of the Decorin. The mean follow-up was 4 months plus. Now it's more than that. Systemically, there was no systemic safety adverse effects whatsoever. The characteristic thing is that after the operation, after the vitrectomy, the eyes were absolutely quiet, no fibrinous reaction, which is known to be present in these very severely traumatized eyes. Functionally, most of the patients actually improved their vision. Of course, these patients preoperatively had very poor vision because of the severe trauma with the vitreous hemorrhage. ERG, there was no significant worsening during the study. Anatomically, the retina, as you can see in one of the patients here, the anatomy in the macular area was absolutely within limits. Anatomical results. Remember, these are very, very traumatized eyes. The globe survival rate was quite high in the second group of 400 micrograms. PVR cases, 25%, only a quarter. And the anatomical success rate was 75% in the second group of 400 microns. So this is the surgery in the repair. This is the exit site of a patient with a pellet. I mean, this is a quiet eye, which you really don't see when you operate on a patient who had a double perforating injury. Usually after 2 weeks or 10 days, there is a lot of reaction and the start of PVR. This is the same patient, 1 week post-op, 2 weeks, 4 weeks, and 2 months post-vitrectomy, and this is after the silicone oil. You can see that, I mean, the amount of proliferation is minimal. Okay, so this is the OCT. So what about the pharmacokinetics? We tested the serum levels in normal individuals and ocular trauma patients without any injections, and you can see these are healthy. In any trauma to the eye or any trauma to the body, we have the Decorin levels up, and this indicated the release is a response to trauma, and vitreous Decorin levels were also tested in our patients. We had a normal group who had no pathology except maybe macular holes, and then a control group where these are traumatic ocular trauma cases without Decorin, and the injected group, you can see that the level of Decorin in the eye persisted. So in conclusion, well, Decorin, which is a naturally occurring protein, has a potential role in modulating the wound healing after trauma. Usually, it is secreted naturally in the body in response to trauma, but obviously this is not sufficient. It needs to be boosted by intravitreal injection. We used the 400 micrograms, which proved to be safe. Vitrectomy with adjuvant Decorin could reduce the rates of the PVR and traction retinal detachment. This is only a pilot study, and we need to carry on. So it's just a question in the quest in the prevention of PVR. Will Decorin be the one? We'll wait and see, and we'll carry on and pursue our studies. And thank you very much.